You may have seen the story of this girl. This is 18-year-old Georgie Redmond, who for 13 years has eaten nothing but ramen noodles. In fact, Georgie says her mother buys her as many noodles as she can afford. The New York Daily News reports Georgie has an extreme dislike of fruits and vegetables. Doctors say it's basically a condition in which extreme picky eating lasts from childhood. Doctors also say Georgie is malnourished and now has the health of an 80-year-old. Well, that obviously is an extreme case, but it comes on the heels of a new study that shows more than 1 in 4 parents believe their teenagers' health choices today won't affect them tomorrow. The truth is, poor health choices can lead to illness, stress, even drug and alcohol use. Our next guests are going to share with us what we as parents need to know about how to keep our kids healthy now that'll extend through their teen years and beyond. Susan Ream is with the National Foundation for Infectious Diseases. Aria Finger is with DoSomething.org. Ladies, thank you so much for joining us this afternoon. It's great to have you.
Thank you.
Susan, let me ask you real quick. It's important that we get our kids to the doctor, isn't it?
It really is. Every professional organization recommends an annual checkup for teens, and yet only about 2/3 of teens actually get these annual checkups. And it's there that we can do a variety of things, including preventive care like vaccinations. We can open up discussions to teens about the things that matter to them. But more importantly, we set the stage for a lifetime of health with annual visits.
So we just shared some amazing facts from the study. Can you share some more with us about that study?
Absolutely. We mentioned that only 1/3 of teens get annual checkups, but the majority of teens are really interested in their health. They want to do the right thing. They even worry about their health much more than their parents think they do. We also had a very interesting finding that physicians think that teens are talking to their friends about health, but in reality, healthcare professionals are the ones who are the most trusted source of information for teens. So we really need to leverage that and use the good start that teens have to build on it and to allow them to talk about the things that are important to them.
Teenagers are internet savvy and they go there, but there's a lot of information there that can be misleading. So we really need to guide them a little better, don't we?
Well, I think that there's a few interesting things from the Perceptions About Teen Health survey, and one was that while teens go to the internet for some information, they actually are more likely to ask a parent. They want to talk to their parents about teen health. So for all you parents out there who are saying, whew, I don't know how to talk to my teen about these issues, you can go to myteenshealth.com, and that's a trusted resource for parents to figure out this teen health information.
You know, we as grown-ups, as it were, we know we've got to be honest with the doctors. Teenagers aren't not so willing. Why is that?
You know, I think there's a variety of reasons. That we know that as adults, going to the doctor and kind of bearing your soul and so on is not necessarily comfortable. And the Perceptions About Teen Health survey showed that 40% of teens said they're not necessarily comfortable talking with their healthcare professional. But you know, we have such a variety of venues that teens can go to these days. A school nurse is a really trusted source of information. And by accentuating and building on our annual health prevention business, we help to build those relationships that hopefully help people to be more comfortable as time goes on.
So in keeping that open relationship with our teenager, what would you suggest to maintain that communication?
Well, I think that it's the parent's job to get their teen to the doctor every year, and obviously teens can help in that. But then you got to get out of the way a little bit. So while you are at the doctor's office for that annual checkup, which is a great first step, make sure that you give time for the doctor and the teen to talk on their own, because there might be some uncomfortable issues that the teen wants to talk about, and they don't want mom or dad listening in.
All right, Susan, Aria, thank you so much for your time this afternoon. Some great information that we're going to put to work. Appreciate that. Well, if you'd like more information on what Susan and Aria discussed today, go to delmarvalife.com and click on the show tab. You'll find that now on the left side of our homepage. Still to come on Delmarva Life, when it comes to buying a home, you may want to consider protecting it with a warranty. But understanding what's covered and what's not can be a little bit tricky. We're going to help you make sense of it all. Plus, with so much talk of a housing market comeback, you may be wondering if now's the right time for you to buy or sell. We're going to find that out too. Delmarva Life will be right back.